Добрый день, дорогие друзья, добрый день, уважаемые коллеги. Да, я не оговорился, мы все коллеги, потому что мы сегодня поговорим о роли пациента, врача, общества.
Yeah, patient, a health practitioner, a society.
Practicing good health habits, saving lives, and so we just don't want to live. We just want to live happily, and want to have a healthy life. So we have selected so wonderful speakers panel. So let me introduce my colleagues, and there's Mr. Farahov. So great doctor, good organizer on the healthcare system. So member of the Duma. Larisa Dmitrievna Popovich, Director of the Institute of Economy and Healthcare of the Higher School of Economics. And there is nothing to add. So the person who knows exactly what we are paying for. And so then practicing doctor, teacher, speaker, Mr. Babak. And so then probably the most needed doctor, yes, the oncologist. So that's very much in demand, especially in advanced age. Mr. Reshetov, an oncologist. So then the most important doctor always, yes, as dentist. Dentist, as a head of the public chamber of Tula, so head of the specialist stomatologist and dentist of Tulskaya Oblast, Mr. Erk. And the most needed, the most sought after doctor. So Moscow Hospital. There's a primary medicine, health Minister of Healthcare, working in the Ministry of Healthcare, and the chief doctor, the most important doctor, and Natalia Alexandrovna Pachenko, Minister of Health of Lugansk. And colleagues, let's begin our deliberations. And before I announce the first, so because we need just to protect health, we need to save health, we need to store health. And this is the most important issue, the most important task that allows to cover all the forces concentrated together just to increase life expectancy and quality of life. So extending happy life, active life, quality life. And you cannot imagine this process without measures of prevention and the modification of risks and especially of different diseases. Very often just you have to deal with a patient. And one of the most frequently asked questions that you have to resolve every day is motivating, encouraging patients to practice good health habits, changing behavioral, social behavior and related risks. That's why we need to modify risks, to change the risk, and mitigate them, and so from practicing doctors to the decision-making people, and for the efficient management of these risks. So one person's efforts is nothing. It will not be sufficient. So then the success can be brought only in consolidated, targeted, joint cohesive work and creating conditions whereby good health habits and quality of life is good for everyone, good for the doctor, good for the patient, and good for the state. And the statistics goes to prove that, but remembering the most modern methods of treatment, which is another aspect of saving lives and increasing life expectancy, we would not be able to reduce mortality, because I say so. Even if just here we did it and there we didn't do it, here we failed, here we didn't fail, it doesn't work. It should be harmonized together. That's why we need just to shift the focus onto prevention of possible diseases, and knowing the medical history of our patients and the genetic predisposition, we can say that what's going to happen to this person. And I would like just to you to talk about which way the medical community should move and in which direction. So please, I would like, what do you make of what we need to do first and foremost? This magic wand, please. Thank you for the introduction. Since I have very little time, so then I will use the cramps and slides. So I'd like to concentrate on a certain concept of risks, unidentified risks. There's a stage-by-stage progression to healthy life. Because the role of the doctor in present circumstances, because we have reached the ceiling of medicinal therapy, so we have lots of medicines, but what else can be done? So then to improve quality of life. So there are regional approaches to modifying the risks of health for our patients. So there are five risks. Five risks. So first is smoking, then alcohol consumption, irrational food, then sedentary way of life, and absence of adjustability and overcoming stress. So this is all these things. So we call it healthy way of life. Healthy way of life. It's not that you need to wash your hands before eating, that you need to dress warmly. No, just what you need. So we can change the life of our patients and decrease the chronic diseases if we decrease all these five factors. It's very interesting because this concept has a scientific foundation. There is an approach as cardiovascular health, they call it. So there are 8 main modified factors come into play. So they can be modified for the patients and increasing life expectancy by how many years? By 15, 20 years may be added to the patient's life so then good food, absence of sedentary activity, glucose in blood, sugar in blood, stop smoking, then absence of obesity, good sleep. So since I'm a pulmonologist by profession, pulmonologist, so then you need just to stop smoking and good sleep. Good sleep is very important because sometimes we make a mistake when smoking. A patient comes and has obstruction of his lungs. So we're not even talking because they're afraid just to tell the patient to stop smoking because they will not trust. How to create trust so that the doctors will be trusted? How to explain they need to stop smoking. So those who are not tobacco dependent, they need to stop just one time. Cutting smoking, that's it. And those who are dependent, who are addicted to smoking, we need to modify harm, switching over to alternative with the follow-up, stopping smoking. So first, and this is the strategy of switching to the system of, for example, heating tobacco system that saves the pulmonary harm and pulmonary danger. So it was we calculated the model. A group of experts participated, switching 20% of smoking people to electronic systems. So saves 25 million years of life for the Russians. 19 million. To understand, just one year of quality life added is 1.2 million for simple. For oncology, 7 million rubles saved, and orphan is 22 million per person. So that's why the total profit is 8 trillion rubles. Is it a lot or not? So then, demography program is only 3.3 trillion rubles. So a huge resource is freed that could be targeted, that could be taken elsewhere. Then another. It's so bad sleep, insomnia. They make a mistake because they think that 6 hours of sleep bad, 8 hours of sleep bad, but 7 hours sleep is good because it reduces mortality by 17% and mortality from other causes by 19%. So 6 is too little, 8 is too much, 7 is the best. And so we need an instrument that identifies these things. For example, this is a new technology that's, for example, so the disease is related to insomnia, and obstructive apnoea, dyspnoea, and so then it's not related directly to different diseases. So then they start to modify the life, change lifestyle. So then comorbidity decreases as well, and they need to be diagnosed. And then in conclusion, I would like to say that this concept of interaction of all stakeholders in creating this doctrine, and so the Medical Association of doctors so appeal to all of us to make sure that all different communities join forces to introduce in the present day clinical recommendations, clear-cut, streamlined recommendations for the patients with chronic diseases. So then should be developed very well based protocols for treatment. Thank you. Sergei Lvovich came out with a very important strategy. So when it's clear, simple, at the same time, we correct the behavioral patterns of our patients, increasing their quality of life and life expectancy. So it's not just propaganda of healthy habits, but and I'd like to ask our next speaker what behavioral risk factors are most common in the Russians today, and what we need to do to change those behavioral factors and the Tula region experience vis-a-vis healthy habits. Good afternoon, colleagues. It is true that saving health is a priority of the main tasks provided by the president. So then increasing the life expectancy of the Russians to 77 until 2030, by 2030. So and the state invests a lot in the development of healthcare system in Russia. And what's important is reducing risk factors. And unfortunately, so banning something, that doesn't work. So it's impossible to say, so do only this way, don't do it that way. It won't work. So how to encourage people to do that? So what we need to do is we need to modify people's behavior, because the majority of the risk factors we're talking about, so they're behavioral or they're manageable. So lifestyle depends on the person himself or herself. And so that's why. But certainly it is determined by the environment where he lives, among who he lives. And that is why practicing good health habits is not only a medical task. It's more a social task, a mental task. Changing the mentality of our people, you can change the behavioral patterns. And as was said, so then the risk factors that we spoke about, and so smoking, drinking, carbohydrates, sedentary way of life, etc. All this is dictated by the rhythm of life that we are living in now. And certainly we need to modify these risks and choose the way of life that the basis is the conscientious attitude to yourself and practice good health habits. And then to make important decisions, you need just to use clearly calculated, clearly cut main data. So, for example, the center of so then that health of the Russians, top 5 values among the Russians. So because you have to one thing is just to want to be healthy and to act it. So that talking the talk and walking the walk. It's just different. That's why we need a comprehensive interaction between business, state, community, person. So if we look at some subjective attitudes towards of the Russians towards their people, so only 23% of the respondents speak that so they pay attention to their health. And look at how many Russians talking about the risk factors that exist in their lives, and so then, for example, sports. So 48%. So they think that they're in good shape, but 73%. So that in the last month they haven't done any sports. They haven't exercised at all, haven't worked out at all in the last month. So then good food. Good food. So yes, everyone loves to eat well. And in spite of the fact that everyone understands that good food is important, then still 60% of the Russians so prefer tasty food to healthy food. And so then the right food takes place number 5. And 46% pay attention to labels on the food products, eco, bio, but it's not a priority when they buy. When they make a decision to buy, it's not their priority, bio or eco. Then and for the medicine, the most important, so the basis of this is certainly prevention. This is the basis of all medicine. And so about 26% ignore screening, regular screening. They just ignore it. And in spite of this, lots of worries, medical workers, doctors trying just to provide information about that. So why don't they do it? Because they feel well, and they don't think it's important just to go see the doctor, and they. And they don't understand that, because if they see a disease at an early stage, it's much easier, faster, and safer. So if they do the checkup early, so only 6% know about the medical screening, medical checkup, and only 5% of the Russians are using regular medical checkup. And so then people from 18 to 34, so with higher education. So is and high level of income. Those are the typical people who go for a medical checkup. So many Russians have no time, have no chance to pay attention to their health as it is needed. For example, in Tula region, starting from 2019, so we started to screen. Not using the principle just to attach someone to a medical institution, but the principle is the same. So where a person works, so then owing to the help of the governor, so they always notice they can do the medical checkup where they live, and rather than what medical institution they are registered with. And this is very important. So many of you have seen that Mrs. Golikova was saying that next year, so the mandatory checkup and screening of working individuals is a must. So it's certainly this modifying risks, mitigating risks. Risk mitigation is the order of the day. So to make people take care of their health. So because a lot of money, so financial, human resources are spent to demography, different projects, healthcare, and national projects. So the main thing is increasing life expectancy to 67, and then increasing the share of the people who practice good health habits, a healthy lifestyle, and so abandoning bad habits. Certainly, these projects are intermingled. And so then the indicators of the healthcare projects and programs to reduce mortality of the working people, and it's certainly oncology and cardiovascular problems, main cause of death. So then I think that the bane of the Russians is oncology, localization. So then the mouth is easier to localize, easier to examine. So has the highest level of bad condition. So 82% of cases were diagnosed at a late stage, and so the identification of cancer at an early stage was only 3%. And now the situation is much better. More than 60% of the Russian Federation of cancer is identified as, so they're diagnosed with cancer at a late stage. And that's a medical factor, diagnosed with cancer at a late stage. And so then they do the different equipment developed by our scientists and Moscow medical and dentist institutions. So it became one of the partial of the program of state guarantees. So it's free, it's provided. So then we're getting. No, so we're getting good results, and because now we managed to diagnose such cases at an early stage. So then, the late identification of the presence of cancer went down 20%. And so that more than 40% of the patients were diagnosed with cancer at an early stage. And so we certainly that's a risk group. Certainly, elderly patients is another group risk. So then, alcohol dependent, tobacco dependent people. So then we go we visit different institutions, and here are the results. Certainly, they could have been better. So 348 patients so have been diagnosed with cancer. And so we had more than 60% were diagnosed with cancer at an early stage, but there were no prevention measures at that time. People did not were not examined, were not medically checked up, and eventually so they were diagnosed with cancer when it was already too late. And now the situation is getting better. But so now the cancer identification program is more than 30% at an early stage. And so then the scientific approach to modify risks, so then cooperation between the doctor and the patient, and dealing with the patient, so we need to do it very carefully.
Because if you don't do, the patient will leave and the trust will disappear. If the patient is not ready for radical changes in his life, and to help patients with low motivation of changing his lifestyle, you need soft methods, like, eating an elephant piece by piece, gradually. So let us move patient slowly from the risk factors. They may remain, but they will be less harmful and significant. In dentistry, everyone loves Chupa Chups, but we say it is sugar-containing candy is actually very negative for the teeth. You can certainly tell the child, but he will not listen. He will find a way at school, somewhere else. But can you modify? Yes. We have another same Chupa Chups, but with sugar substitute, that it will not harm the child's. But definitely without sugar, these Chupa Chups, this candy will not harm the teeth, because there is no sugar. So the risk has been minimized. And many doctors say we live in the age of carbohydrate galore. You go shopping, you have everything: cakes, candies, chocolates, sugar-containing drinks, and the drinks that contain less sugar, they're less harmful. So why don't we teach people to select less sugar-containing drinks? And that's another risk factor. Smoking. When I was looking at the statistics, is that like a conclusion that I saw? Cancer rates grow by the year, and only recently we saw a reduction of cancer. But it's ironic, if we saw growth of all types of cancer because of better diagnostic, but the cancer of lip by 2013 for over the last 20 years went down by 60%. How can we explain it? And for myself, I decided to think about it, and certainly I was that we saw our men who spent most of their free time smoking. And the situation in the country was tough. Everyone was smoking to reduce the stress, and their yellow or brown fingers. So the temperature of burning cigarette was up to 800 degrees. It certainly was harming the lips. And then we saw other types of cigarettes, filters, and the lip cancer went down. Is it the filtered cigarettes are better for health? No, but less thermal factor that burns your lips. It's a golden standard. Yeah, stopping smoking is a golden standard. You better drop it. Quit smoking. People should quit smoking to preserve their health. And nicotine dependency is a disease, and people should understand that it's both a chemical and psychological factor. It's very difficult. For instance, a person quit smoking, didn't smoke for many years, and then some stress or whatever happens, and he starts smoking again because it is again the recurrent disease. Our people have to take care of their health, and doctors in this situation should have a chance to offer an alternative, not to push the patient away, not to scare the patient. And just like sugar-containing products, the state should make a decision to mitigate those factors, try to help people avoid things like cigarettes. And the cigarettes should have less availability and more pressure from the state. Thank you for your attention. One of the healthy habits, the healthy mouth should be green. That's yeah. I will go back about the healthy green mouth. So you reminded me of a verse of Omar Khayyam. You never eat something that is crap, and you don't drink, rather than drinking with you don't know with whom. Yeah, Omar Khayyam is a wonderful poet, and you raised a very big issue, the rate of oncological diseases. No matter what we do, we still have the same three: cardiovascular diseases and malignant tumors. I want to ask Dmitry Reshetov to tell us about the ways of prevention of oncological diseases. I thank you so much, dear Chairman, for letting the oncologists talk at such representative events like the Congress today that we have today. Those modified risk factors play a great role both in prevention and reduction of morbidity in oncology. Speaking about oncology, it certainly has a negative connotation, especially for the patients. If we honestly consider this question and professionally, if we ask the question if cancer can be cured, we can say yes. What kind of cancer? It's either the one that has not yet appeared, speaking about cancer prevention, or the tumors at early stage, first and second stage tumors. That's exactly what our colleague mentioned about the diagnostic capacities. And it is not just the problem of treatment, but it's medical and economic, because as we know, the cancer at the late stages are technically very costly. It's energy-consuming process, and it's it costs a lot, and not always successful. Such patients are a problem. And if we look at this chart, we shall see there is an error risk factor of any chronic diseases at this slide. The next slide will speak about cancer, but this one is general. And we see that the modified risk factors account for many diseases, bad food habits, use of bad products, including alcohol or salt and sugar. And you see non-modified factors like genetics, obesity, excessive weight, and in red we see this cube, the tobacco smoking factor, because tobacco, especially for oncological patients, this is one of the most important risk factor. Alcohol, I can sound a little bit optimistic. In fact, for oncology, alcohol is not that significant compared to tobacco. Presently, it is proven that for oncological diseases, for approximately 42% of those cases are caused by those modified risk factors. And we see this red. Alcohol is only 5.6%, and smoking is some 20 to 24%, according to among the factors that we consider. And it is important working with the oncological patient. It is important not just the fact of smoking, but the years of smoking, direct dependencies. The longer people smoke, the higher the risk. And we can see that quitting smoking improves the statistics for oncology. The longer the person doesn't smoke, the less risk for him to get sick with oncology, up to 30% reduction to get cancer. If you don't smoke, the risk to get cancer in the period from 1 to 4 years reduces by 30%. The longer people don't smoke, the lower the risk. Along the smoking factor as a trigger, it is important to have this factor during treatment. We all know that a treatment of oncology patient is a very multi If we look at the chart, we see that there are studies that have not proven a negative factor in smoking, continuous smoking, to the process of treatment. There are two valid studies that we can see, and that shows significant dependency of the quit smoking factor before treatment to the result. And one of those studies, 153 patients with the early stage of throat cancer, one of the classical models of cancer that usually appears only in smokers. And we see that if the patients stop smoking before treatment, then the positive results are observed much higher. The mortality from reduced to 29%. So the patients who stopped smoking before treatment survived much better. No comment. You can see the percentage on the slide. What are other adverse effects? What are the complications in patients who keep smoking? during cancer treatment. A high rate of surgeries, because we know that smokers can develop microcirculation damage and whatever. It all makes surgery worse. And chemical therapy actually is not as efficient in smokers as the enzymes that inactivate those drugs in the liver. And it was noticed that smoking patients the risk of so-called cytotoxical complication, myelotoxical complication is much less. It seems to be good, but in the same proportion, it reduces the efficiency of chemotherapy. So if a patient smokes, then the chemical therapy will not be efficient. Irradiation therapy. 115 patients, the flat cell cancer of head and neck, one of the frequent zones of smoking impact, 66%, 2 years survivability in non-smoking compared to 39% in smoking patients who smoked during the irradiation, who were kept smoking during the irradiation therapy. And we keep telling it to our patients. There are many patients who suffer head and neck tumor. They keep smoking. And when we talk to them, we prevail that they need to stop smoking. Otherwise, the treatment is not going to be as efficient. We show them the numbers, and our colleagues from High School of Economics and the Economics of Healthcare supplied the numbers. Economic losses for each smoker are approximately $1,000 a year, and a huge number of the virtual lives or lost lives for those people who keep smoking after being diagnosed with cancer and started treatment. If we extrapolate, we have proven if all the smoking patients, all 100% at least, stop smoking, it would be an ideal model. We cannot always achieve it, but at least if we convert them to alternative tobacco heating methods, the cumulative effect from this transfer may be up to 4% of the GDP a year. It's billion and billion of rubles. And in addition to that, preserved lives. What's the problem? The problem is we have one of the most stringent anti-smoking legislation in the world. And when this work started, we saw very good progress. People stopped smoking. But we see nowadays that we are now at the even phase. Those who wanted to quit smoking did so, but presently now the number of those people who are ready to stop smoking is the same. We reached the upper threshold. It means that we need to switch to other ways of persuasion, like take these chupa chups away from the mouth. Those who wanted to did so, but someone is still smoking, kept it behind the cheek. And we need to provide alternative to those people, to those bans that we presently have. And speaking about the clinical recommendations, first you see cardiologists and the Association of American Oncologists also came to a conclusion that clinical recommendations are needed for the patients who have options to quit smoking in response to finding a malignant tumor, and along with conversations and some behavioral trainings, pharmacotherapy, they need to get information accurate and scientifically proven about the alternative ways of tobacco heating for nicotine, because this way really works. Unfortunately, not for prevention, but at least for reduction of complications of conventional cigarette smoking for this category of patients. Thank you. Thank you so much, Dmitry Nikolaevich. Oh, I recall it once Professor Lebedev and I, we had a seminar, and we saw that patients with substance abuse take much easier the procedure of coronary vessel stenting. If you never, so why? So we said, if you don't smoke, you don't need this stenting surgery. And another problem that you raised is economical aspect. Everything we do in healthcare is huge cost. Certainly it saves lives and quality of life, but it incurs huge expenditures of the state to fight this multi-headed dragon. You cut the heads, but they grow again. And economic evaluation of prevention. Larisa Popovich is requested to talk about our activities. Economists are people that can calculate everything, no matter what is the unit of calculation. Most important, they need numbers. And the numbers that we heard today can be called too low or too high, depending on the measuring units. Unfortunately, the problem of our great country, where people are supposed to live happily, long and happy, is that demographic factor is the main constant that we need to improve and support. Only through demographic policy we can improve economy and healthcare, whatever. For many years, we were spending 10% of our revenues to healthcare, independently of the budget, being it positive or negative. It's not GDP, but 10% of the money. It is very high. It is not less than other countries spend. The problem is that the human life that the economists calculate differently, from 2 million up to 400 million, depending on the methodology, is virtually priceless. And in Russia, when the number of the people who die is unacceptably high, the problem of fighting risks is paramount. You see how the mortality structure looks in Russia. In spite of the colossal efforts, the
cardiovascular mortality is quite high, and de novo formation mortality is high. But the world understands that both oncology and cardiovascular diseases, they belong to a group of diseases that are preventable. They're preventable, and so from a higher. So this is a preventable group of diseases. Some of them may lead to death. So you can prevent, so the good treatment so prevents death, and some of them are preventable by prevention measures or good treatment. So we're just watching how actively different countries are involved in preventive measures. And the most recent study published in Lancet magazine related to the Association of Cardiologists. It's the most recent study goes to prove that it attributes risks of cardiovascular mortality in the following way. So look what risks influence the mortality of cardiovascular diseases. I'm not going just to that almost all of them, one way or the other, are related to the diseases that can be modified or controlled or monitored. And hypertension, so unfortunately Russia is the leading country in this way because there is no control and monitoring of hypertension. Then diet, smoking, certainly, and then high level of so then obesity, then sugar in blood, smoking, kidney dysfunctions. All these risks can be modified, can be mitigated, and so then in the most recent. So they distributed the risks of the development of de novo formations on oncology, because not all oncology diseases can be prevented, but many of them may. So, for example, for men, smoking is the leading risk of death of oncology. So then results in different oncology diseases, and unsafe sex for women is danger number 2. So with Russian oncologists, they did a good study some time ago that evaluated what would happen to the patients if the patients with kidney cancer or lungs cancer. So if they gave up smoking, so what would be the result? So they did the clinical study, and the result, an economic study was made as well. So that if they gave up smoking, so then there would be a certain period of there will be no recurrent cancer for a certain period of time if they give up smoking. So there will be no relapse, so then per person is 2.5 million rubles of the direct spending of a medical organization to treat the relapse in oncology. And so then with the diagnosed smoking patients who gave up smoking in process of treatment, so 2.5 million, because so there is no relapse and there is a reduction of cancer danger. And so if you talk to the patient, so life is very valuable. So we extend these patients' lives. And but fully understanding the importance of such preventive measures, we cannot achieve and make sure that the patients would stop smoking. Because why? Because the healthcare system is a big branch of social psychology, and each one of us is a unique person with a combination of values and attitude towards health, and so the system of obtaining information, evaluation of information, and that is why we need to learn. We need to work in a more targeted, individual, customized, bespoke fashion with each patient. So we have developed a very good classification that includes 96 methods of influence broken up into 9 groups and aimed at change of behavior, behavioral patterns, so encouragement, changing of behavior. And we need to understand that there is no single strategy of transfer to the modified behavior, because we need to look for this strategy every time, so which is very important for our doctors, for the medical community, for expert community, and so that's what we do. So we develop such targeted programs that which will eventually manage to get the attention of the patients, to get through to them on this. And so that they would understand that it's great to live in this great country and take care not only about your family but about yourself. And So the social psychology is one of the most important components that we're going just to promote as one of the key competences of the medical community, and because understanding these risks that will be translated into a number of targeted programs that will certainly improve the situation, which is absolutely inadmissible right now. It's just wonderful, fantastic lecture, excellent, just great to find. You remember this movie, The Adventures of Electronic, and so where is that button? So we need to find the button and press it, and then it will get the so then the patient it will get the patient thinking. So you've seen just how the state decision has been formed. There is an initiative group that appeared. So then the initiative group organized the discussion of the experts. Then they consolidated into a certain proposal, and with this proposal, we came to you, to the organizer, the deputy of the healthcare system, and we brought it to you. So we've gone with one of the profile committees of the Duma. What happens next? So we just brought it to your attention. Good afternoon. It's a great presentations. Wonderful presentations, very convincing statistics. And I think that at this point we could end. But the amazing thing is, and more importantly, so in the medical community, so there are lots of people who think differently, and the things that we're discussing right now, and we need just to speak more about that, to bring it to the attention of the medical community, because many. Okay, I have a suggestion. A proposal. I think that this notion, modification of risks, that's too complicated. That's not a Russian term, and I think that at the end of the day, we need just to speak Russian, and we need to convey this idea in different wording. So there was a federal budget that was adopted. So now, then the expenditures of the constituent units of the Russian Federation are being adopted right now. So then the federal fund of mandatory. That's 6 trillion rubles, huge. And there's mandatory medical insurance, etc. I've been dealing this with financial provisioning of resources, and so we never had such huge expenditures. That's a lot of money, and we spend a lot on healthcare, and we need to talk. So then the next year, so maybe we'll just get some profits for the money spent on healthcare. So that's a lot. That's a lot of money. It's not enough. This money is not enough. We need more, and so when we say it's not sufficient, so we need to increase taxes. But who's ready for increased taxes? So there are no such people who want to pay more taxes. That's why we need just to use our reserves. So what are those reserves? So then first to efficiently use the money available, and then so one of the most important reserves are the things we are discussing now. And so then in the near future, so that would be the biggest reserve. That's where the money is. When these new ideas get born, and so we as legislators, so we look at ourselves, and so first, what is it what's important? How we regulate different positions, because they are reflected in the legislation, in the legislation. In the bills. So when sometimes bans, constraints, very harsh, very strict, that were imposed, sometimes we get the boomerang effect. It strikes back, and so so for example, so then. So when you fight smokers, combat smokers, because we made a decision, then so when we allowed to open up in airports, smoking rooms, whatever, just where the smokers could smoke. Yes, could because they really they were they want a cigarette, and so this. And that is why originally in every regulation. So we should not talk about bans and constraints, but we need to talk about regulation and not banning, not stopping, not shutting down. And this is the basis. And this is so. And the majority of the politicians and legislators they share this idea. So Mr. Volodin in his Telegram channel so actually announced voting. Should we introduce labeling in big words on energy drinks and identify the danger and the harm that those drinks make? Yes, but some people say ban, close, stop those energy drinks, and but we need to regulate rather than stop, because any ban immediately will move into the shadow economy, and it will surface immediately there, and that's why we need to regulate. That's exactly what we're doing when we're trying to make sure that any increase of excise taxes, a new product related to tobacco. So they need first to go through the stage of regulation. Only by regulation we can manage the situation. We control the situation. We may just stop these products, toxic products, and make them available to kids, and so to make sure that it does not reach them. And helps those who need it. So that's why the attitude, how we should have acted, we need to regulate rather than ban, and not to punish for the bans. Then another point I wanted to make. What we were saying, in my view, corresponds to the changes of our behavioral paradigms. So if you have time, I would recommend you strongly so the 200 meters from here. So that's a big, good and a separate standing building, Sberbank office. So it's one of the most technologically developed companies. It's not even a bank; it's a company. And why is it making such tremendous progress? Because the main ideology of Sber is not client centricity that we've been talking about non-stop for many years, and so it helped it a lot. But Sber now comes in the market, and they're not after client centricity, but human centricity. What's the difference between human centricity and client centricity? All people are different, all different approaches, all have different opinions, so whenever just we individually address each person with individual programs, targeted programs, so we look more effective, and it's more workable. And it's so we can achieve the goal we're looking for much faster in a more efficient way. I wanted to say that to prove my point, Amar Khayyam, famous poet, said those who drink will die. And those who are drinking, it's bad, but those who don't drink at all is a problem as well. So out of 37% of people who do not stop smoking, who refuse to stop smoking, we need to find a way to convince them. We need to offer them a solution which at the end of the day would be more efficient, both from the viewpoint of future expenditures on healthcare and future expenditures incurred by the state vis-a-vis smoking. And then in conclusion, as when I was coming here, just the idea of risk modification. So they don't teach it. So students know nothing about it. So many doctors, practicing doctors, so then the clinical level, the doctors, general physicians, I don't think that they're aware of this risk modification, and that is why. So the task is to think up a term. So just I asked AI. I put a question to it. So how can you alternatively name the notion of risk modification? Managing, reducing risk, restraining risk, belittling risks, decreasing risk, regulation of risk, adaptation to risks. And so let's make a decision. Let's just develop this area, and then the term will come by itself. And so it allows us to effectively use financial risks and available resources. So whenever there is this edge, and in my view, we in healthcare. So we should not speak. We should not use the term patient. So many people who cannot get rid of tobacco smoking. So they tried several times, 1, 2, 3 times, and they can't. So, but they can continue calling them tobacco dependent, addicted, and it's very denigrating, and that's why this human centricity very bad for the patient. No, they're not patients. And what's Bear is doing right now is absolutely correct ideology, and that's where we should move all together. Thank you very much. I think that. So let's continue our wisdom competition. So then they say, yeah, it's the longest road starts with a single step. So anyone can drink. You need to know where, to how, for what, and how much. That's it. But you can drink. Yeah. And this rational approach to the modification of a possible risk that we need to follow through upon. And so now we continue work. And I wanted just to go back down. So I want just to go to down to earth. We have 2 more speakers. So then the last but not the least. So Mrs. Pashenka, so I'd like to ask you to talk about the prevention, modified risks in Lugansk Republic. Good afternoon. I've been listening with great attention our respectable speakers, and I'd like to thank for a chance to participate in this Congress. And as I wanted to say that the majority of the reports, presentations, so excited in the different subject. So because it's providing medical assistance during special military operation during war times, and so then your presentations about healthy style of life. First, I was a little bit confused. Yeah, but then I understand that people, so they deserve to live in peace, and they deserve to be healthy. And certainly, so then, because actually life expectancy is 68 years, but we need to remember that we have military losses, people killed in the war, and then in Russia and Ukraine, and we have, so out of 2 million, only 300,000 15, 18 years of age are the kids, 31,000 kids. Is a prospect of a demographic pit, so because demographic ravine, and this is horrible, and so we need just to keep them in our republic, but so even if we manage just to keep them, to make them stay, so how can we guarantee a healthy future for them? And this phrase, Arthur Schopenhauer said, so that it's. So it's much better just to be healthy and rich than poor and sick. Yeah, and but it's true that a healthy poor guy feels much more happy than a sick king, and then.
So what are the stages of the diseases we can influence? We can see at this slide we can only change 7 to 10%, and the rest is genetics, lifestyle, and and situation, environmental. But we can influence our lifestyle and the habits that our children acquire and that today adults acquire are the links of the chain which we have to influence. And studying the age structure of our people, over 50% for women over 30. So the women, we don't have anymore the definition of a woman who gives birth late, but we call it a discussion. The fact, the expression when we say that a woman priority has to first give birth and then career. So this is something that creates disputes in the society. That's true, because after 30 we see the structure of diseases and the pathologies that impacts pregnancies. Over 50% of virtually up to 80% of women over 30 already have at least one or two diseases, and women from 20 to 30 as relatively healthy. Usually if there is a checkup, they are diagnosed with some diseases that influence the course of pregnancy and health of the fetus. And we see here at this slide an absolutely healthy, nice child and average mother and father, and we cannot expect a healthy child of them anymore. And today,
And so then the patient, and to modify, to modify, so then feeding pattern, and to influence the parents' habits. So these are the factors that we can mitigate besides genetic, and so then these things that we cannot go around. So then temptations that then it's certainly sedentary way of life, insomnia, wrong food, starting on alcohol at an early age, smoking, addiction, drugs, energy drinks, so all these temptations, cigarette smoking, that's a plague, that's a bane, and the energy drinks and a combination of vapes and energy. So that's actually this results in cardiovascular. There's a syncope type harm, etc. So we refer to them then early. So then different nosologies, stress, then using gadgets too much, so harming eyes. And then early sex life, ecological situation, infections of sex-related diseases, etc. Then diabetes, so has gone morbidity has gone up in children. First type diabetes, then post-stress dysfunction, and so then so lots of other diseases and dysfunctions. And what we do, so we did the screening medical checkup of our children, and so we did some prevention and screening and identified pathologies. So more than 50% of our children have been screened for the first time, and so then they were diagnosed for the first time. And so then the structure of morbidity, the breakup of morbidity, you see that by. So then first the diseases of endocrine systems, obesity, eyes diseases, then bones, then gadget-dependent dysfunctions, scoliosis, build-up. So then bad food. So then the diseases of gastrointestinal system. So this structure, this pie, tells us about problems and challenges that we are facing and what we can mitigate. And So the main problem is bad food, is bad diet. Let's say bad diet, both in adults and in kids. Is what are the risk factors of obesity, developing obesity? So then it's so diabetes, metabolic syndrome, etc. Propensity for this is there. So even during the fetal development, fetus development, then stopping nursing at an early age, and then so transfer to adult food for babies and infants, and so then. I like this. They call it cardiovascular dissipation. That's a very good word. So that's a plague, and that's a bane that all parents and children are suffering from. So when you go to the movies, so you buy popcorn and then Pepsi Cola and then all this stuff, and then you wash it down with carbohydrate drink and or energy drink. So each patient certainly wants just to bring up a child so that would look like parents, and certainly they are trying just to make sure that the child is happy and properly fed, but never healthy, and this is horrible. And so that is why just for the first line of defense in medical community that will allow just to identify the excess of weight, obesity. Unfortunately, these pediatricians don't use this method, but as a checkup method, it's very available, very simple, and so then so this biometry, bioimpedance metry. So that's the analysis of the body composition, and so then heavy bones, so excess of muscle mass, and then those who are obese because of the excess of feeding. And what leads to the reproduction of capability in boys, because we have problems in girls as well. So in boys, they just they hush it up about the ability to reproduce themselves, but an extra weight in the body. So then we may lead to conclude that the sex development will definitely be harmed as well. So then body mass index. And so that is done by several methods. That's when endocrinologists should come in. And then these are the main prophylactic measures that we need to.
So the application point, the gene factor, the genetic factor, certainly we would like to have healthy parents, and for that to work with the population along with the propaganda of expected plan of pregnancy, then natal screening, and then lifestyle of a child that as parents we need to influence. Then environment and the stress is something that we as leaders and of the local communities, and early help, early diagnosis, and outpatient observation. So certainly it all has to be addressed. And then there's future electronic medical history. This is a profile of the patient that starts at birth, and we need to have it, and the complete forecast for the parents' propensity to have certain diseases. Then the pregnancy course will show us how healthy the child will be, and then further healthy feeding from breastfeeding to then additional foods, and then movement and physical and exercise. And then when we have a healthy child, we need to forecast what may happen to him and monitor the child until he turns 18, when he goes to the adults outpatient clinic, and the risk factor, and how to give a chance to the child to stay healthy. And these 4T, preventive, personified, and patient's role in keeping his health and happy and staying happy. Thank you so much. any conference, any presentation talking about the healthcare processes or society around the healthcare in Russian Federation would be incomplete without experience of Moscow, our undisputed leader and flagship. Andrei, the floor is yours. Thank you so much, dear colleagues. And our session is about the role of a health practitioner and the patient in supporting the health. I would like to speak about the role of a health practitioner. Larisa Dmitrievna spoke about the values that generations have. And I would like to talk about the values that develop and are being introduced today for our healthcare practitioners. Why do we need this system of values? What is that? We understand very well that in each situation, for each moment of relations between the doctor, you cannot regulate everything. All patients are different. All situations are different. And we understand that so much depends on the patient himself, on his lifestyle, risk factors, and a lot depends on the doctor. The doctor should have some kind of background in terms of education and the foundation for making decisions that outside of protocols. And in Moscow, by the medical community, we developed the values system for outpatient clinic. But today, these values are shared by all our colleagues. There are 6 values: patient centricity, professionalism, trust, respect, teamwork, and friendliness. And let me say a few words about each of them. It's not just empty words. These are the conclusions that we have been discussing for a long time in the medical community at different levels between the heads of medical organizations, among the doctors, the nurses, medical practitioners. For a long time, the values and their discussion was just uploaded into the common medical system, and everyone could just comment on this. And out of this, we made the selection of the most important items, and everyone consented, and everyone shared these values. And when we hire new people and adjust in the system, so we bring into the profession through those values. First is professionalism. So in simple words, every time when we get some service, we catch a taxi or go by metro or go to a barber or medical service, we absolutely want that the person who provides this service would be a professional. Just like the people who turn to us, to the doctor, expect professionalism from us. It's clear, it's following the standards and regulations and continuous improvements, and professionalism is the foundation of all the values, and all the other values are built on that. Patient orientation. So it's like client, healthcare professionals don't like. We have a term, this patient centricity. It's not client centricity. It's the knowledge about the patient, the equipment, everything. The patient cannot be always right talking to a doctor. But on the other hand, we need to be thinking about his needs and requirements and his condition, and absolutely should have a capacity and the tools to explain certain specifics of treatment or behavior of a person. And the next value is certainly respect. And today we quoted our poets, and today respect is just you cannot get respect only just wearing the white medical robe. You need to earn it. On the other hand, this process is mutual, and this respect should be both ways, patient-doctor and doctor-patient, and both should certainly demonstrate it. It should be inside the system. We need to respect each other, and working in the healthcare industry. And the next value, team building. It's important to understand that we work together and fighting for health and life. Honestly, I didn't like that slide where the society and doctor and patients are kind of pulling the rope and with the diseases on the other side. Health is exactly on the side of the people, not on the other side of the rope. And so teamwork is a very important principle. The next value is trust, just like respect. It cannot appear overnight without any reason. It's something that you earn, and very often, if there is no trust, we get many problems with non-compliance and other things. And it is important to create this trust in our patient to achieve it. And then copying, and it's important to have kind of friendliness. In many programs, they just give you a point for diagnosing properly and for saying hello. And people say, it's not fair. How can you compare just one hello with diagnosing, proper diagnosing? In my view, very often, if you don't say hello, if you are not friendly, if you are morose to the patient, so sometimes people don't care how you, what you do, because he will not act accordingly. He will go to visit 10 of your colleagues, and it will cause huge discomfort. So probably this kind of friendliness and attention is one of the basic principles that the doctor should apply to the patient. And then basis and professionalism. These all the factors that I listed, the teamwork and everything, are professionalism, professional behavior. So I wanted to talk about the role of a health practitioner and I want to thank all my colleagues, all the organizers. Indeed, this session was extremely interesting and important to discuss. Thank you so much. You know, Andrei Alexandrovich, you just followed up on this wisdom. Everyone knows that math is the mother of all sciences. When I was a freshman, I never understood why we study philosophy. And only when somewhere at graduation, I realized this is a tool that will allow me to do my scientific work honestly and unbiasedly. But the math is going just to describe this. So the wisdom of Moscow healthcare deserves great attention and approval. It is great when professionalism and friendliness work together. So I want to remind you that today we discuss healthcare, both in the Russian Federation. Our Congress is international. I will request the director of Republican Center of Healthcare of Tajikistan to say a few words about experience of Tajik Republic in this respect, in this area. Thank you so much. Thank you for the floor. I'm happy to welcome you, and I thank the organizers for inviting me. I heard so much and heard the experience of many countries. What do we do in Tajikistan? As I'm director of Republican Center of a Healthy Lifestyle, primarily we ask, what is a healthy lifestyle? Do we know anything about lifestyle when we're sick? Who do we start to blame when we get sick? When a person is not responsible, it does not for his health, who is going to take care of it? WHO says that 50% of our health depends on us, but the behavior somehow, the population does not behave properly. We eat salt. We do not eat proper foods. We are not we don't do hygiene and we don't exercise, and finally we say, our body suffers from some whatever diseases. What do we do? Under the Ministry of Health and Social Protection of Tajikistan, under the ministry, we arranged a special coordination council with representatives of all ministries and agencies. As our center works under the national program of healthy lifestyle, the government in December 2021 made a special resolution number 566. Every representative of ministries and is in charge of the component within this ministry, and we arrange health teams, because when we work with the primary chain, we see that the health practitioners are overloaded. They don't have enough time just to walk around their region, their patients, and discuss their health with them. What we do, we involve leaders of the local leaders, like spiritual leaders, youth leaders, women's leaders, who help us and start informing the population about healthy lifestyle, preventing non-transmittable diseases, everything, starting from breastfeeding to healthy food. And the results are good. In 38 pilot regions, we created more than 1,700 healthy communities, 50 people each. And we work, at least when we come to some rural areas, we start talking to them. We heard about it. They know about it. And somehow we help them to act upon it. It's much easier when compared to the instance when you come and they look at you and don't understand why you're there. Now we do it much better, and I thank you very much. I'm happy about the fact that people in different parts of the world come to virtually same conclusions and solutions to achieve goals. I will try to do the wrap up of our session, and we shall probably start working in risk modification, and the proper name will come later.
Then it's not AI, but we'll develop the right terminology for our events, and we'll do it because our today's meeting just went to prove that it's possible just to get together all the doctors, different disciplines, get them together, sit them together, and just then organizers, economists, lawyers, healthcare professionals, everyone, and so then representatives of different bodies of authority, so to develop the only correct decision that we can have. So we'll certainly learn to address the interests of both patients, state, and doctors, and the medical community, different problems related to health. And only our joint effort will allow us just to cover this distance and to move it fast, correctly, and pleasantly. I think that this is the main corollary of our meeting. So because joint effort is a guarantee of success because we know the means, we have the goal. Now let's get going. Colleagues, see if any questions, suggestions, amendments, whatever. Yeah, there is a Russian word. It's spasiba. Spasiba means that God is with us, with God. So we say thank you to you. because we are with God. And one point that my colleague said that, so I need to respond, I have to follow up. So that we need to work with diseases. And at the beginning of my presentation, I was saying that we need to change the mentality, because everyone comes to work in the morning. So we work in the medical community. Our patients come, and each of the patients is talking about their diseases, non-stop, lining up. Yeah, because we need to work with health and not with diseases. Yeah. Teeth, very easy. So there is caries or there is no caries. I have several kids, and so then my daughter is 2 years old, my son is 12, and I was always saying, and we are implementing with the help of the governor this new program, the Smile of Childhood. It's a very good program. So then it's opening up dentists' wards. Yeah. So then take care of your teeth while you're still young, because then you won't be able to take care of your teeth. And so my kids don't have a single caries, but I never fixed my kids' teeth. I've always been working with health and not with diseases. Thank you. Okay, shall we? I think that so this 1.5 hours have been very effective, efficient, and I don't know about you, but I enjoyed associating with you and with my colleagues. Thank you.